Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Welcome back to the Going Deep segment brought to you by CO2 Lift. Today, we'll be diving into an important yet often underdiscussed topic, lichen sclerosus. Now, for those of you who don't know, lichen sclerosus is a chronic condition primarily affecting the genital areas, resulting in patchy, discolored, and thin skin, which ultimately leads to a slew of other symptoms, including itchiness, blistering, scarring, urinary issues, painful sex, and just so much more. While there are treatments that can help, lichen sclerosus is a lifelong issue. And even if symptoms clear, you're always at risk for them coming back. But here to break it all down for us is a very special group of experts. Dr. Shyrlena Bogard is a board-certified gynecologist with a holistic approach to health, helping women reclaim the lives they love by tackling complex challenges such as sexual health, hormonal imbalances, and weight management. Dr. Amy Brenner, joining our panel, is a board-certified OBGYN with over 20 years of experience, certified in integrative and functional medicine, and the medical director of her leading practice and medical spa in Cincinnati, Ohio. Turu Sukhotin is a spiritual and energy healer, Kundalini and Reiki practitioner, and someone who has dealt firsthand with lichen sclerosus. Together, they're here to share their insights on the condition, from detection to diagnosis, treatment options, and how they're helping women reclaim their health and vitality despite this challenge. Welcome to the show, superstars.
Thank you.
Thank you.
So excited to have you on, my experts on the microphone. Turu, I'm going to start with you. So lichen sclerosus is a completely life-altering condition, and I know your own journey with it began as a deeply personal health crisis, pushing you into physical, spiritual, and even mental burnout. Can you walk us through your early journey from the moment you realized something was definitely wrong to deciding to seek treatment and your path to healing? What were those early days like compared to now?
Well, thank you. That's perfectly put, honestly, because that is what happened. I had received in early 2021 a COVID vaccine and had a pretty immediate allergic reaction, just rashes all over my body. And not long after that, I realized that I was having tremendous pain. I'd had a period that ended up becoming kind of a spontaneous menopause from what I know now. Went in to see the doctor, was developing just a tremendous pain in the vaginal area. And I had no idea what was happening. And so, at that point they told me, well, you have lichen sclerosus. I had never heard of it. So it sent me down a pretty deep rabbit hole. What I realized at the time was that this was not really talked about very often. Even in the office, the doctor said, well, here's some cream. You're just going to have this forever. And so I didn't like that answer. It was not good. And
I wouldn't like that answer either.
Yeah, I thought, no, that's not what I'm going to do. So I went down this entire journey of learning more about what it was, not that we even totally understand, some treatment methods. And then ultimately, I knew I had to balance it with healing my mental state and my energetic state. So that's what kind of led me down this very intense, beautiful path.
Well, thank you for being so vulnerable in sharing that. I mean, it really underscores how this condition doesn't just affect the body, but it actually impacts every layer of a woman's life. And your story it's a true reminder that healing is both physical and just as much emotional. So thank you for that. Dr. Shyrlena, let's shift to you and talk about the cause, because this is a bit of a tricky topic. So while the cause of lichen sclerosus is still largely unknown, it has been proposed to be an autoimmune condition. And we also know that postmenopausal women and young girls who have yet to go through puberty are at higher risk of developing the condition, which is so counterintuitive if you think of it, right? So as a gynecologist with extensive expertise in women's hormones, why do we see this condition between hormonal changes, especially around menopause and the onset of lichen sclerosus? I mean, what exactly is happening here?
And the pre-puberty years, as well as in the menopausal years, when estrogen levels are naturally low, it does put a woman who has a predisposition to it at risk, because estrogen, one of its functions is to be an immune regulator. Also, directly on the tissue, what estrogen does is it helps to the body to produce collagen. And we need collagen for having the elasticity in the tissue. We need the collagen to maintain the thickness in the tissue, as well as to maintain moisture in the tissue. And oftentimes when I've had patients in the office, the way I would describe it to them, if you think about your lawn, when you have healthy grass that's nice and moist and you go and you bend the blade of grass, it doesn't break easily. It's nice and moist. It has what we call snapback. Whereas the grass that has no estrogen, has no moisture, then that grass is thin, it's brittle, you bend it, it breaks easily. And so this is what happens when women have low estrogen levels. And so they get micro tears in the tissue because the tissue gets thinned out. Now the tissue is more susceptible to exposure from toxins and things. And now we get these microscopic tears, and then that begins the inflammatory response. And then that cascade begins where the lichen sclerosus begins to develop.
So now, Dr. Brenner, let's bring you into the picture. We covered cause, so let's shift to diagnosis. You've successfully treated countless patients with lichen sclerosus over the course of your career, so you've seen this condition up close. While lichen sclerosus affects just about 200,000 people in the United States, that's according to the Cleveland Clinic, it's still, quite frankly, poorly understood and often just misdiagnosed. So for those unfamiliar, questioning, what do you see as the key signs or even symptoms for early detection? And what does the testing or diagnosis process typically involve?
Early on, I think a lot of patients are misdiagnosed or are self-treating and self-diagnosing. And what I typically hear is they think it's a yeast infection or recurrent yeast infections or recurrent bacterial infections, UTIs, and I think a lot of women aren't going to a specialist or even going to a gynecologist or even surprisingly not even getting a pelvic exam, but are just treated for UTIs, bacterial vaginosis, yeast infections by either a PCP or urgent care or even just treatment with over-the-counter. Because the symptoms are early on are typically itching and burning, which obviously are as most women know, typical of yeast infection types of symptoms. But as the disease kind of rages on, then the symptoms can be present 24/7, tearing, pain with intercourse. I've had women describe it as feel like they're being attacked by multiple razor blades. And then in long-standing lichen sclerosus, it can even lead to anatomic distortion where the labia start shrinking or fusing to the labia majora, or the clitoral hood, the tissue surrounding the clitoris, fuses over, and women will notice things are changing the look down there.
You're right. Yeah, that's such an important breakdown because so many women just dismiss these symptoms or assume, to your point, that they're normal changes or yeast infections. So the more we can normalize this conversation, the more likely women are to seek help sooner. So thank you for that. Turu, let's talk about treatment. So we'll start with your actual journey. So your healing journey combined ancient wisdom with modern medical modalities. I love that. Could you share a little bit about which treatments, both conventional and alternative, made the biggest impact in managing your lichen sclerosus?
Did not get that knowledge, when I went in. And, what I was given was what kind of felt like a death sentence to me. And it was like, wait, what? I'm not going to be able to feel anything, and I'm not going to be able to have pleasure, and I'm not going to be able to feel like a woman. So it took a while to find some treatments. It was several years later, and I just suffered with it.
Oh.
I did find one of those laser treatments, the YAG. So I had that done a few times, and it was quite painful. In the meanwhile, I was going through this, major awakening and learning these beautiful modalities, the energy healing and Reiki, Kundalini. Then, I did work with some, I am also do hypnosis. So I was doing all of these things to help myself. And then realized that I had a profound gift for it. And it was it was my calling. So through something really, traumatizing came something completely beautiful for me.
Right.
But when I discovered the CO2 lift, I cried. I cried the first time I used it. And I will, after a couple uses, I was starting to tell people, I feel 18 again. And it's one of these things where I thought, that will never happen for me, right? I thought, okay, I've gone to a certain level of healing and I'm doing really well. But until that pain level was kind of taken down, I didn't realize how much pain I was just coping with. So it was quite a mystical moment for me, honestly. So now I'm just want everybody to know that there's hope, that they can really, really feel good again. I would say within 3 treatments, I just felt like a different person.
I'm going to cry. Your vagina bounced back.
My vagina was like,
Yes, it happened. So Dr. Amy, let's pivot to you now. So what treatment strategies have you found most effective in reducing symptoms and improving quality of life for your lichen sclerosus patients? Piggybacking off of what Turu just said.
I'd say 99% of gynecologists are going to recommend a steroid cream for lichen sclerosus. And although if somebody has early onset lichen sclerosus, that can help with the itching and the burning. But what it doesn't do is it doesn't stop the disease process. And so the disease process rages on with a steroid cream. And so what that means is the labia eventually start fusing, the clitoral hood can come over and cause scarring. And for a lot of women, or at least the women that have sought me out for care, is eventually the steroid stops working. But the benefit of the steroid is it's inexpensive, it's covered by insurance. But most of my patients aren't wanting that type of treatment. I definitely think that there's a role for the for carboxytherapy or the CO2 lift, especially in women who are postmenopausal, who have the double whammy of lichen sclerosus in the setting of an atrophic vagina due to menopause and lack of hormones. And the CO2 lift V is something that women can take home on day one and start that treatment. And if somebody has severe lichen sclerosus and a lot of architectural changes or also severe atrophy, that is something I will use. Or if they have a lot of excoriations or really thin skin, which is a negative of the steroid cream because it thins the skin with long-term use. Carboxytherapy is a great addition to prep the therapy or the prep to the tissue before I do one of my other treatments, which I've had the most success with, is using energy-based devices like a CO2 laser or a RF microneedling. And both of those devices make tiny little holes in the tissue. And then when your body heals, it regenerates new healthy tissue. And so in our practice, we use our energy-based devices in combination with growth factors, either from the patient's own growth factors, something called platelet-rich plasma, or using placental-derived growth factors and then injecting the affected area. So we'll use that. And then in somebody that has also atrophy or low hormone status, we'll also use either topical hormones with or systemic hormones. Not that they're treatments for lichen sclerosus, but they increase blood flow to the pelvis and the vulva because those have testosterone and estrogen receptors. So it's really an individualized approach. And that's what we found. And in our practice, knock on wood, we've had 100% success rate of getting people symptom free from their lichen sclerosus.
Wow. I love that 100% success rate. You go. Oh, wait, that's incredible. And the most important part is that, you're seeing the change and it's encouraging to hear, especially because it gives women hope that symptom management is possible and effective and life-changing. And there's actual results there. I love that. So Dr. Shyrlena, let's shift back to you. So let's say you've successfully treated a patient's lichen sclerosus, but as we know, it's a chronic lifelong condition. So looking long-term, what ongoing medical and holistic strategies do you recommend women incorporate into their daily lives to manage these symptoms and minimize the flare-ups?
So from a medical standpoint, early detection. So getting regular evaluations, maintenance, CO2 lift V, carboxytherapy at home, because for any energy-based treatment that we do, any hormonal supplements that we do, It helps to maintain the health and integrity of the tissue long term, and it prolongs the need for any additional treatment. I oftentimes do recommend that women take vaginal probiotics that help to maintain a healthy vaginal flora, along with decreasing any irritants. So some of the advertisements for cleaning the tissue down there, sometimes they can have harsh chemicals that can be irritating. And so we want to get rid of any harsh chemicals and irritants to the tissue. Maintain a healthy diet. If you can, you want to decrease your exposure to anything that's pro-inflammatory. So any synthetic foods, any of the processed foods, sugars, any of those things that cause inflammation in the body can cause inflammation in the perineum. So we want to look at removing those. Also, cotton underwear. You want to wear loose fitting underwear or no underwear at all, but cotton. So you want things that don't increase moisture, and so that you can get some air and the tissue because anything that creates warmth and moisture is going to be a breeding ground for bacteria, but also an irritant to the tissue. And so we want to look at things like that.
I love it. Sleep commando and no tight jeans. Now, Turu, beyond physical symptoms, lichen sclerosus can deeply impact the woman's sense of identity, of sexuality, and self-worth when we talk about that trauma. So how do you help women reclaim their power and reconnect to their bodies after such an experience?
Yeah, thank you. What an important conversation this is today. I'm so grateful to be part of this with these incredible women and you. Thank you so much. It's it's challenging in general to be a woman, right? And we know we go through so many phases in our lives. But when your vaginal area is affected like this, it has such a tremendous impact on your self-worth. And so it's so important to calm the system, tap back down into who you are, and let that energy come through you so that your body can heal. Because like she said, it's if your mind is fighting with the body, you're not going to be able to feel okay. In terms of stepping into this kind of like beautiful sexual identity that we have, that we, were given, it's really important to consistently tap into that. It's a daily practice to just remember who you are and fall in love with yourself every day, regardless of what you may be dealing with in your life that can feel, troublesome or difficult. So yeah, I feel like in combination with these amazing things that they're talking about today, which, when I discovered this, did not know about any of this. So I'm just blown away. In conjunction with, really learning how to calm your system so that it can heal. It's just profound. I mean, honestly, I think one without the other is not going to be, give you all the impact that it can. So I highly suggest that women dealing with this seek that kind of help or find the modality that they really feel resonates for them so they can help their body heal.
I love that perspective. It's so much about rewriting the narrative, moving from a place of feeling broken to a place of feeling whole again. So, and this is a very important conversation because it goes beyond lichen sclerosus. Now, Dr. Amy and Dr. Shyrlena, this question is for both of you. Dr. Amy, you could go first, but I'd love to hear from both of you. So many women battling lichen sclerosus feel isolated and sometimes too embarrassed to even tell their doctor about their symptoms, which contributes to underdiagnoses. So with so many women suffering in silence, how do you both encourage individuals to break through the embarrassment or stigma and seek that professional care they need?
Sure. Well, I think I'm so grateful that you're doing something like this where people are raising awareness about lichen sclerosus. And I think nowadays there are a lot of resources out there. And I think the answer for women is to, not take no for an answer. And if you are looking for something more than just here's a prescription for a steroid cream, see you later in a 5-minute OBGYN visit, that there are practitioners out there that do more than just here's the steroids, see you next year. And to be an advocate for your health, and there are resources of like this, and to seek the care that you're looking for and that is right for you.
Yeah, that's exactly the kind of compassionate, stigma-free approach women need to hear. And the more we open these conversations, the more lives we can improve. Dr. Shyrlena, what's your take?
I agree with everything that Dr. Brennan said. It's so important that we're having these conversations. So I thank you for opening this platform, because as you know, we can't even say the word intimacy on social media without getting some type of tag. And so it does affect women. So having spaces to have these healthy conversations, to normalize these conversations, it's so important. But I also think women, as Dr. Brennan said, we have to be advocates for ourselves and recognize that when we address these things that are affecting us on a private level, it helps us to be a better person in every area of our lives. And so we do show up differently. Our confidence increases, and we don't have to beg permission for that. We have the right to feel healthy and whole and complete, and to be able to have healthy, intimate relationships. And so the woman who takes charge of that, the woman who takes control of that area of her life, she has that confidence in every aspect of her life. And so having these spaces to say, there is a practitioner, as Dr. Brennan said, who will help me, who will give me solutions that work for me, and not just the Band-Aids, and never take no for an answer. Because we do exist, those of us who, because there are women, as you said, we practice in a man's field, obstetrics and gynecology, both of us, and the perspective that you get oftentimes from female, and I'm not saying men physicians are bad, but sometimes women, because we experience it ourselves, our approach is so much different. And so when you're experiencing in these things, do your research, but know that there are practitioners out there who support you and want to help you from a healthy, holistic approach.
Well, you are so right. We are at the end of our date, my friends. Thank you so much for joining me on this incredible panel. I learned so much, very transparent, very inspiring, full of information, and a lot of empowering conversations here that I think our listeners and our viewers are going to appreciate. So thank you both, Turu, for your transparency, and Dr. Brenner, Dr. Shyrlena, for your knowledge. Experts on the microphone always make a huge difference on our program.
Thanks for having us.
Thank you so much.
That was our Going Deep segment, brought to you by CO2 Lift. And thank you again to our beautiful panel of experts for joining us to shed light on lichen sclerosus. You definitely want to check them all out. We're going to start with Turu first. You can head to Instagram and check out her page at multi_dimensional_healing. And you could head to multi-dimensional-healing.com. You can also check out Dr. Amy Brenner at dramyvbrenner.com, and on the gram at Amy Brenner MD. And Dr. Shyrlena Bogard, you could find her directly at healthylongevity.clinic, and on the gram at Dr. Shyrlena Bogard. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.